Matt, thank you so much for agreeing to come on Shrink Wrap Radio.
Oh, it's a pleasure to be here.
Well, firstly, can you tell us how you came to be interested in the history of health and healthcare?
Oh boy, that's a very long story, but a lot of it boils down to a couple of years where I was working for the YMCA in Edmonton, Alberta, in Canada. And my job was to help troubled kids who had dropped out of school and who were involved in gangs and drugs and all sorts of not very nice things. And one of the things that we would do during the course of our interventions was try to give them access to provincial funding to go back to school. And one of the things we realized is that if we managed to identify these kids as potentially having a disorder of one kind or another, they tended to get more get out of jail free cards when they messed up. And the big one was ADHD, attention deficit hyperactivity disorder. And so at the time, I didn't see anything wrong with this because it literally kept them in accommodation and sometimes in school for longer. But I eventually started to get curious as to why we were only really focusing on their brains and not all the social factors that were contributing to why they were seeing us in the first place. So those 2 years sparked an interest in ADHD, which led to more research on mental health, and ultimately interest in some other things as well: food, nutrition, allergy, and immunology. And just a lot of it focusing on asking questions about why we do things that we do when it comes to health, and why haven't we considered other options.
That's a great story, and it does. You can see the trajectory and how it makes sense. I seem to be echoing. I don't know. Oh, it's gone away. Hopefully that won't intrude on the recording.
You sound great on this end.
Oh well, that's good. I just heard it on my side, so hopefully that's not coming through. But before we dig into the details of the article that I originally read in the conversation, which was a fascinating article, just a brief explanation of why you believe that understanding history can actually help so much. I understand how it became part of your story, but why do you think it matters?
Yeah, okay, that's a really important question. It matters because for a couple reasons. One, it helps to understand why we do what we do. So in the case of mental health and psychiatry, if you look at just even the past, say, 50 or 60 years, we have different approaches, different explanations, and different treatments for mental health problems emerging. We have psychoanalysis, which is very dominant, say 50, 60 years ago. We have the emergence of biological explanations and all sorts of bodily treatments, ranging from ECT and insulin shock therapy and lobotomy and drugs, of course. And then we have all sorts of social explanations, looking at the social determinants of mental health. And then we have lots of people saying, hold on here, I don't think I'm mad or mentally disordered at all. I think it's society that's making me feel this way. So in order to understand why these different explanations come and go, it's very important to look at the history behind them. So if you want to understand why psychoanalysis becomes so dominant in the United States during the middle of the 20th century, well, you have to know about the Holocaust and the Third Reich, because many Jewish psychoanalysts from Central Europe had to leave, including Freud himself. And many of them ended up in the United States and Canada and England and other parts of the outside Central Europe. they bring their ideas with them and they become quite dominant. So if you don't have an understanding of the history, you don't know why psychoanalysis becomes such an important concept and idea. Equally, if you want to know why something like lobotomy becomes an acceptable treatment for people during the middle of the 20th century, you need to know something about how psychiatrists felt that they were rooted in the asylum. They weren't really seen as doctors. They were just superintendents of asylums. They weren't seen as being on the cutting edge of medicine. I mean, pardon the pun. But when lobotomy emerges in the 1930s and 40s, it is seen as cutting edge. These people are doing brain surgery, and they see it as we're entering medicine. We're becoming respectable and authoritative and like a legitimate medical discipline. We'll get the best medical students entering psychiatry, not the worst. So that's the one thing. In order to understand why certain things come about and become popular or authoritative, you need to know their history. I think the other thing, and this is the other side of the coin, and this is more looking to the future, if you know those stories, it empowers you to make different choices and to make different decisions. So if you know that, for example, something serendipitous happened that led to a lot of the psychiatric drugs that are now used were discovered very serendipitously.
Like tuberculosis.
Yes, yeah, exactly. So once you know that, and you know that, things could have gone down a different path, I think you're empowered to say, okay, here we are now dealing with what a lot of people think is a mental health crisis. What could we do to do things differently? And then it maybe empowers people to go down a different path and think of things differently. So for me, I think there's been a tendency in history sometimes just to say, well, things are complex and leave it at that, partly because I came to history trying to understand working in a more, educational, clinical environment. I've always been motivated by using history to make a difference in some way. So I hope that answers it. But yeah, I think it's partly to know where you've been, but also to empower you to change where you're going.
It strikes me, actually, I'm also very interested in ecology, and it strikes me that in understanding an ecosystem, you need to know the history of it. You need to know that those species were brought in perhaps, on a ship in the 1890s, and that they then spread from New York to wherever. And you have this same kind of understanding of how things got where they are, and why, perhaps some species became a trouble in a certain environment. You need to know how it got there, and it also has the same benefit of allowing, you have to be careful about your about a sort of bio security if you're going to prevent sort of fungal diseases to trees, for example, coming in the future. So you have that same way of thinking working in many different spheres, don't you? It totally makes sense.
Yeah, and I think the other thing is that it also gives, especially in medicine, I think it can create a sense of humility and a willingness to not just accept the thing. This is the epoch. This is the zenith of knowledge, and we know everything. And maybe we'll talk a bit more about this, but I think, some of the physicians working 500 years ago within the paradigm of humoral medicine, I think some of their concepts of balance and lifestyle are eminently applicable today. They knew far more about nutrition than most doctors know today, for example. And it was understood in different terms, but in the sense of, if you eat certain things, it will have an effect on your physical and your mental health. They were much much more in tune with those sort of things. And that connects with ecology as well, I guess.
Yeah, so I'm thinking of indigenous communities, but also Ayurvedic medicine, and the understanding of, well, and isn't it something crazy? Like 70% of our medicines are from plant roots anyway, and to have that that understanding dates back absolutely centuries. And it's really only in recent years that we've sort of justified folk beliefs by having a sort of scientific inquiry that's gone into, oh, actually there is willow bark does have this something that's very similar to aspirin in it, or that's very interesting. So let's sort of focus in on the article now. First of all, the title. When I said to Dr. Dave that I was really keen to interview you, and the title was How to Solve the Mental Health Crisis, and he said, "Wow, that's ambitious." so yeah, it's definitely an ambitious title. I don't know if it was the editors who put that in, or whether you'd have chosen that, the editors.
yeah, that was not, well, I've worked with the conversation a few times, and I know when when to let them have their say. And with things like titles, often that's that's what catches people's attention. If it was called something not so provocative, no one would have read it, I guess.
Well, it certainly provoked me to read it. So first of we'll go through sort of chronologically in our sort of history, and one of the things I was really interested in was the idea of 19th century asylums, and we think of them as these nightmarish madhouses, but you suggest that's not quite right. And a quotation from the article: "Such portrayals mask the impressive ambition, care, and expense that went into the building of many asylums by governments around the world during the 19th century." And I thought that was very interesting. What did you take from 19th century asylums and the portrayal of them?
Yeah, so asylums have been understood in different ways. So many historians have seen them as tools for social control. And I think that's true to a very significant extent. But I think it's also important to view them as a product of Enlightenment thinking. And the Enlightenment wasn't just about, retreating or getting away from religious and spiritual explanations for phenomenon. It was also an optimistic attitude towards solving the world's problems. So, if you tackle social problems with scientific expertise and determination, you can solve them. And I think the asylum is part of that attitude and enthusiasm, I suppose, for it might sound trite, but making the world a better place. And so if you look at many of the asylums that emerge in the late 18th and especially during the 19th century, these are places, first of all, that are meant to replace worse places. So the workhouse, the poorhouse, and prisons primarily, where many people who would have been suffering from various mental ills would have been found prior to that. So an example of that is the Montrose Royal Asylum up on the east coast of Scotland, and it was founded by Susan Carnegie. So it's very much a philanthropic enterprise, and it's definitely an early example of moral therapy. So she wants the patients to be treated well. She wants them to have opportunities to, do occupational therapy, to do art therapy. And she wants the doctors that work there to, treat their job seriously, to be, staying at the asylum for extended periods of time rather than going from place to place. And it's part of this effort to try to cope with social problems, that are affecting towns and cities in places like Scotland and England. So I think the other way to think about it is just literally looking at the asylum as a building. These are impressive buildings. In many places, the asylum would have been the grandest building around, apart from a church or a cathedral. So why are they made like that? And even when they start building the district asylums and the county asylums, so these are the public asylums, funded by largely public money and maintained through public monies. These are often very impressive buildings as well, and I think part of that, it isn't just because the superintendents, managed to convince them to put all this money into the asylum. It's because they're seen to be important places that are, meant to help people. And when you look at asylum records, although problems emerge almost immediately. As soon as asylum is built, all of a sudden there's more patients than there are beds. There's problems with funding, problems with hanging on to staff, but that doesn't take away, and that is often what leads to the deplorable conditions. And certainly some of the conditions are absolutely deplorable in asylums throughout the world. But I don't think anyone builds an asylum in the 19th century expecting it to become deplorable right away. They're building it, I think they build them largely with good intentions. It's just that those intentions aren't always maintained by resources, and in some, there are, the other thing that's important to note is that there are different asylums. Some asylums, they use restraint and coercion and force, and there's abuse at far higher levels than there are in other asylums. So, and we see that today in psychiatric facilities as well. Well, not hopefully not some of those things so much, but you might recall the Panorama documentary of last year, where that those sort of things continue. So so I think that's important to note, is that these places were initially intended to be places for good, and if we think of them in that way, then it's a way to perhaps reconsider, the image of the asylum, as you I think rightly say, how most people see it. We've just had Halloween, and I think many people see them as being scary, frightening places, and they would have been for many. But I think for other people, they would have been asylums in the true sense of the word.
Yes, that is it. As you were talking, two things came to mind. One was, and I don't know if I'm just if this is leapt into my mind from a sort of a false connection, but in the 20th century, did sort of Wilfred Owen and some of the shell-shocked soldiers go to? Was that the one in Montrose? I mean, I'm sure it was somewhere in Scotland that they went to.
Yes, Craig Lockhart.
Craig Lockhart. That's it. That's it. Yes, and the treatment there sounded as if it was very good treatment, but of course that was some time later. The other thing I was thinking was that I remember reading Michel Foucault's book on Madness and Civilization, and that very much has the idea of the concept of control and separation, rather than this idea of nurturing in a safe haven. So that it kind of depends on the onlooker's perspective how you read the history of asylums, and also the fact that they varied.
Yeah, absolutely. So I was doing some research in Inverness recently on the Inverness District Asylum, and there they were very keen, and in other Scottish asylums, they were very keen to board out patients. So get patients living back in the community. And these aren't patients that were recovered. These were patients that were still ill. Now, sometimes they were doing, and it's a nuanced, complex story. So sometimes they were doing it because it was cheaper to do that. But in the records, there's also an acknowledgement that, people, especially, Highlanders in the Inverness District Asylum, they did not want to be cooped up in the asylum. They'd much rather be, living with families. So, that particular practice, in terms of how we see the asylum, it kind of makes those walls a lot more porous than Foucault would have it. I think it's important to look at the individual cases as well and see how they differ. But I think certainly Foucault and his idea of social control is really important in terms of thinking about not just the asylum, but how we prescribe or how we diagnose people with various disorders.
Yes, I wanted to get onto that, but one of the things that the asylum does bring up in your conversation there, when you're talking about county asylums and district asylums, is the idea of the public responsibility. There seems to be a very strong sense of a public responsibility, rather than a private one in that era.
Yeah, definitely. So there are private asylums where people pay money to go. But there are also a lot of, by the mid-19th century, there are more and more district and county asylums, and those are mainly funded through the public purse. But also you do get wealthy benefactors chipping in as well. So again, up in Inverness, you have local estate owners will donate venison for the kitchens, for example, or they'll sometimes will take patients out on day trips and that sort of thing. Bands come in and play for the asylum patients. So there is a to and fro between the community, and that reflects, I think, not just the fact that these that it isn't maybe not as feared in the community sometimes as we think, but also that people recognize that although this is apart from the community, it is also in some ways part of the community. Right. Also, we have, and part of that is that their asylums are big employers. They employ many, many people. So there is that kind of, like I said, kind of a porous sense that we don't always take into account. People would have supported the asylum, through taxes and the rates, but also, like I said, wealthier people might contribute as well in some ways.
Moving on to a sort of slightly different area, in the article you brought up the history of pellagra and explain why understanding that is important or relevant. Could you give us an idea of what you drew from that and what is pellagra and why is it relevant to this story?
Yeah. So pellagra is a vitamin deficiency disease. It happens when you don't have enough niacin, and it was prevalent in certain parts of the world, most notably the southern United States and parts of southern Europe, especially northern Italy, where corn had been introduced as a cash crop, and where poor populations had to rely on corn, and corn, if it's not processed in the right way, does not allow for the take-up of niacin. So so the first thing I guess to say is that this is an example, I should say that pellagra initially affects certain parts of the body. Eventually, it'll affect the brain, and it leads to insanity, basically. So in the southern United States and in northern Italy, for example, the asylums were filled with pellagra sufferers. So what this tells us, one, is that the causes of mental illness are not always as straightforward as you might think, right? This is, who would think a vitamin deficiency would lead to madness, but also pellagra fundamentally is a disease of poverty. It's a disease that only affected the poor, because people that had money enough to have a more diverse diet would have enough niacin to prevent it. So it's a really interesting example of a cause of mental illness that really gets us to think in a more open-minded way about potential causes for mental illness, but also back to kind of one of the most basic things in the history of mental illness, and that is that poor people are most desperately affected by mental illness, both in terms of, more susceptible to it, but also having not having access to the best treatment.
I guess sort of syphilis to a certain extent is in some ways similar, although not strictly a disease of poverty, but probably a disease of unfortunate women who were forced onto the streets. Were going to be more likely to be sufferers of syphilis too.
Absolutely. And in asylums towards the end of the 19th and early 20th century, depending on where you were, the three of the main causes would have been pellagra, syphilis, and then alcohol-induced psychosis. So three all preventive causes, totally preventable.
And that would be the majority of the people within those asylums. In
certain asylums, that would account for a lot of the patients, an awful lot of the patients. It would depend where you were. Obviously, pellagra is not going to be a factor in Britain, but there would have been a lot of the other cases of syphilis and alcohol-induced psychosis as well. So I think it makes us open our minds a little bit in terms of the factors that can contribute to poor mental health.
So the people who, when they came to the understanding of these things, was it then and in the early 20th century that there was much more focus on preventative medicine within the mental health sphere?
Yeah, so generally there was, and there were a couple reasons for this. One was that there wasn't much in the way of treatment. This is long before the modern psychiatric drugs. It's before ECT, electroshock therapy. It's before, there would have been versions of psychotherapy in the early 20th century, and psychoanalysis was up and running by that point. But if you were in an asylum, there weren't all that many treatment options open to you, apart from things like hydrotherapy of various kinds, occupational therapy, so work therapy, and maybe if you're lucky, some types of moral therapy, so access to playing music or art or those sorts of things. But in terms of what we think of as treatments, there wasn't that much. So that's the one factor. If you wanted to reduce the number of people going into asylums, you needed to prevent it, because once those people were in the asylum, they were probably going to stay in there for a while. But the other thing is that, a bit like the Enlightenment, the turn of the 20th century, especially in the United States, is an era of is the progressive era. So it's an era of, again, kind of faith in our ability to do things differently, to do things better, and many people jump on board, including many wealthy philanthropists who fund various types of initiatives geared towards preventing ill health, including mental ill health.
You write in the article about, and I suppose it's not in the early 20th century, but it maybe stems from a sort of similar cause, the 1963 Community Health Act. And why is that relevant to your analysis? Yeah,
so for the first half of the 20th century, there's a mental hygiene movement and a child guidance movement, and these are both focusing on mental health. They both tend to be preventative, and they're both rooted in the idea that there are social determinants of mental health. They didn't have that terminology, but that was basically what they were thinking. Many of these initiatives, or most of these initiatives, tend to be funded through private philanthropy. So the Rockefellers, for example, in the United States, fund a lot of mental hygiene and child guidance initiatives. During and after the Second World War, however, this really puts the spotlight on mental illness even further. So going into the Second World War, the United States in particular embarks upon a very aggressive psychiatric screening regime for recruits. They do not want to have recruits suffering, going to crack Lockhart or the equivalent in the United States, suffering from shell shock or combat fatigue or whatever term they were going to call it. So they end up rejecting 1 million applicants to the Army on psychiatric grounds alone. Despite that, they end up having 1 million admissions to hospital for psychiatric reasons. So all of this raises concerns about mental illness, not just within the military context, but within American society more generally. And so this is when you get the foundation of the National Institute of Mental Health, and you start to get a gradual buildup of funding and resources to try to investigate why mental illness exists. So psychiatric epidemiology. All of this really culminates in 1963 in the Community Mental Health Act, which is the first time the federal government in the United States invested significantly in mental health. Prior to that, it was all down to the states, and it would be very, there are 50 different states, all with very different approaches and different ideologies. So you got all sorts of different outcomes. After 1963, this is a significant investment in mental health from the federal government, and it sees a shift from the asylum, which we were talking about earlier, to community mental health, so to treating people in the community, but also crucially prevention. The Community Mental Health Act was meant to be a preventative approach as well as a clinical approach in terms of treating people. So it's very significant in terms of it signifies a moment when preventing mental illness is seen to be very, very important and something that taxpayers should contribute to, even in the United States, where getting taxes out of people isn't always the easiest thing to do. But I think it also represents, and this is something I'm interested in researching further, I think it also represents a culmination of really a 50, 60-year period from the early 20th century of a lot of people working individually and in groups trying to do the same thing, trying to explore the social and environmental aspects of mental illness to look to preventative solutions.
It seems as if the preventative solutions tend to be seen on a sort of social or community level, whereas now the focus on treatment, and I would assume to a great extent in an asylum as well, but certainly now the focus on treatment is very much the individual, and there seems to be something of a misfit there. If causes are so often social, then how can treatment function perfectly on an individual level?
Yeah, so I think this is a real paradox, because as I was saying with pellagra, pellagra gives a perfect example of how, on one hand, it's a poverty issue. Poverty is causing it. But on the other hand, you have a very specific cause that's only going to affect certain people in certain parts of the world. So I think with mental illness, we often have to think, we have to have two ideas in our head at the same time. But I think that doesn't happen a lot in mental health circles, and unfortunately in mental health policy. It's usually one idea that dominates. And so after the Second World War, and the Community Mental Health Act really symbolizes this, there's a shift of population mental health to dealing with mental health or mental illness on a population level, and coming up with, if not, significant social change, at least with the intention that we should be changing society in ways to make it better for mental health. What happens in the 1970s and 80s is partly due to shifts in the political landscape. economic decline, and also developments within psychiatry itself, we have a shift back to looking at individual explanations and solutions for mental health. And I mean, it's no surprise that this happens during the 70s, which is known as the me decade, and we get this not just in terms of mainstream psychiatry. You also get this in radical psychiatry. So you get all sorts of really idiosyncratic therapies coming up, like scream therapy or LSD treatment, and some of these things are coming back. But what's important is that it's no longer let's deal with society, let's focus on you. And so I think, especially with the challenges that we've been facing, or many people have been facing in the last 15 years with austerity, with COVID especially, and most recently, the cost of living crisis, I think, we're starting to maybe come back a little bit to the population solutions. And I think the other thing is that we've got many decades worth of evidence to suggest that the pharmaceutical solutions and psychotherapy, they might work for some people, but it's very difficult to roll that out for absolutely everybody. So we need to, rather than just focus on the treatment, we need to go back to trying to stem the number of people dealing with these problems in the first place, which ironically, in a way, for most of the 20th century was the thinking. Was prevention, it was public mental health, community mental health. It's only really been in the last 40 years or so where this shift back to the individual has dominated.
Yeah, there's so many things arise when I'm hear you talking, and it don't know which bit to pursue you on first. On the subject of the individual, I was thinking also about the personal empowerment and very much this idea of personal development movements, and you still see that a lot. I mean, I read some books that were sort of highly critical of the idea that it's kind of all in your mind, and that if you think in a better way, and if you become a more effective person, and if you do this, you can stop being X or Y. That can actually make it harder or make it worse, because you feel like a failure as well as having the problems that you already have. And I wonder what you think of the because I think there's still a lot of that, particularly in sort of the consumer culture on TikTok, Instagram, those kind of areas.
Yeah, I think that even extends to fairly well established approaches such as mindfulness, such as yoga, changing diet. These things are all well and good if you have the time and resources to engage with them properly. If you're from a demographic where you're working multiple jobs, where you're juggling childcare responsibilities, where your load of worry and stress is that much higher because your bills are much more of an existential threat, and on all those sort of things, not only do these personal therapies need to do a lot more work, if you know what I mean, but you're also going to be less able to take advantage of them. So I think that's the other side of it. And I think these days they're probably, although some of these like concepts like mindfulness pretty well established, some of the things that do come through social media certainly might not be. I think the other thing that's interesting right now is that we also have this I think quite helpful concept of neurodiversity, and this idea that we are different. I might have different abilities to concentrate and to focus on things in other people. And so rather than forcing people to change for societal norms, maybe we try to make society a bit more accommodating. And certainly working at a university, we do that. People have disabilities and different learning disabilities. We do make accommodations for them. So I think I think it's good in a way for people to understand how they're different, why they're different, and to come up with strategies to deal with that. But we also have to recognize that not everyone is in a place to do that. And we can make society, if society was a bit more forgiving, a bit more supportive, a bit more egalitarian, then some of these approaches, which probably have quite a lot of value, could be employed more readily. So, this extends not just to, I guess, kind of psychological therapies or social, but also things like social prescribing. So, your physician might say, why don't you go for a walk up in the hills and clear your head? Well, do you have access to those hills? Do you have access to walking boots, that can get you there? Do you have access to the education to help you navigate yourself when you're up there? So, we have to look at these things in a much more holistic way if we want them to benefit the people that really need those benefits.
Yes, that is a very important point. And I was also thinking, when you were talking about neurodiversity, and I was wondering, one of the people that Dr. Dave interviewed before, and I've got his book, but I haven't read it. Nobody's Normal, and he was talking about the idea that we are all sort of very diverse, and that in the past, being different might not have been quite so different. It feels to me as if there's a huge drive in our sort of weird Western educated, industrial, rich and democratic cultures to kind of homogenize our experience to an extent, that this is the way that you see the world, that that you are strange if you sort of X, Y, and Z. And I wonder if that, I personally feel that that's unhealthy and unhelpful. Partly with maybe the suggestion of long ago history as a guide. But also I read a book recently by a guy, Jerome Bernstein, called On the Borderland or something, where he's talking about people who have sort of different experiences and I think he was maybe going a little bit far in suggesting that there's a sort of a kind of more of an ecological openness that the sort of future requires. But certainly I do think that there's a lot more diversity were we willing to accept it as individuals within our own minds, and that diversity within our own minds may actually embrace areas that are usually categorized as being a disorder.
Yes. A friend of mine, when I told him I was writing a book on preventing mental illness, or the history of preventing mental illness, he quipped, well, if you want to prevent mental illness, just stop diagnosing it so much. And it's a bit of a flippant comment, but there is something to the effect of, why do we pathologize people who are a bit different, and why don't we value them more? And I think I'm with you. I think we need people, especially if you want to tackle the existential problems that we're facing, like climate change. We need people who not only can think differently, but are willing to act differently. I work in a university, and part of it is because I am from another country where things are done slightly differently. I'm always, and this is another answer to your question about why history is helpful. Historians ask why questions. So, we're always, well, why? It's like a 4-year-old, who's always pestering you. Why is the sky blue? Why is this? Why is that? But, why questions are also disruptive. they're challenging questions. And so in a university, I'm always asking these disruptive why questions. And it's hard. It's kind of exhausting to have to always ask these questions and not get satisfactory answers. So I think, if you're neurodivergent and you look at the world in a different way and you're wondering, well, why do we do things like this? Why? And you're not, and maybe if you can't express yourself in a way that's effective, it's very frustrating. And unfortunately, we're frustrating the very people that probably have the solutions to some of these big problems that we face, so I think, I think it's very useful to ask those blue sky questions and in all sorts of different contexts, and it almost, again, it's, if you're in a position of privilege, it's much easier to do so. But that's something that I think, we could build much more into our school system, getting kids to be disruptive and challenging in a positive way, questioning why we do things the way we do. And I think a lot of those questions would probably at some point meander back to mental health.
It's interesting what you say about schools, because I remember speaking to someone from the Netherlands, and I'd always thought that all the people from the Netherlands that I'd met had been very sort of straight, not combative, but asking, didn't accept something as said, would ask. And he said, that happens in schools. We're taught not to just, soak things up, but to question, to ask. And I thought that's very interesting. And the work that I do, some sort of academic work in the area of animals and the environment, and there's a lot of very progressive thinking on that score from Europe in general, the continental Europe in general, but there do seem to be a lot of people from the Netherlands who are willing to think, and I imagine there's probably sort of similar structures within Scandinavian countries, and just as a sort of different way of approaching the idea of education as being something that the child discovers for themselves rather than is handed.
Yeah, definitely. And in a way that kind of gets back to why I got into all this in the first place, because one of the reasons ADHD emerges is because education in the United States shifts from being much more progressive and child-centered to much more teacher and subject-centered because of the Cold War. So again, we don't, if we know this, we can decide, well, we can do things in a different way. And certainly the other aspect is, understanding that other countries have different approaches and maybe they're doing things better than us.
You mentioned earlier that there were two things that I wanted to see before your 3 preventative strategies, which obviously are of key importance at the end. One of the things you mentioned was about diagnosis, and the other was your particular interest in nutrition and understandings of the past. And I wondered if you just wanted the opportunity to explore that a little bit here.
Sure. So I think in terms of diagnosis, I suppose it comes back again to this idea of who defines what normal is and why do they define it in the way they do, and to always be, questioning that. I mean, even when we think about the various iterations or editions of the Diagnostic and Statistical Manual of Mental Disorders, the psychiatrists debate and argue about this all the time. Certainly, when DSM-5 came out, there were huge debates about how depression should be diagnosed, and other things. And some things come in, some things come out. So I think understanding that happens and that's actually a good thing, so that it's not simply, the idea that we need to identify the flaws in the human character and make sure that we weed them out. I think it's more about disorders reflect the societies that they're found in, and that when we're not happy with society, maybe that says a bit like, R.D. Laing said, mad to be normal, kind of flipping the mirror around a little bit. And just, what was the other thing? Sorry, nutrition.
Yeah. I mean, I've personally, I think that it is sort of so interesting. I mean, just on the gut body axis, the gut brain axis, isn't it?
Yeah.
And the fact, I know there's there was some research done into hunter-gatherers, and the hunter-gatherers, the huge variety of different strains in their gut bioflora or gut biota was just incredible. Whereas most people eating a kind of more of a processed food diet, it's a lot more limited. And even, I'm vegan and I eat a lot of vegetables. I mean, really, I don't tend to buy processed food. I make my own food, and it's basically vegetables, but I'm still aware that I'm probably eating maximum 20 different vegetables throughout the course of the year, or maybe 30. And had I been sort of like foraging around, I'd be forced into eating sort of 50, 70 different types of leafy berry things. And it does strike you how incredibly not just unhealthy but limited our diets probably are.
Yeah, and so there's that aspect, and there's also concern about what we do eat, in terms of not just the, too much fat, too much sugar, the things that we're told all the time, but all the chemicals that we consume as well. And, my PhD was on food additives and hyperactivity in children. So, and that idea goes back decades and decades and decades. So, I think it's something that for a long time, going back a long ways, physicians and just people interested in mental health would have taken for granted that your food has an impact on your mental health. And really, for the last, quite a long period, we've forgotten that. And only now we're starting to come back to it. Which is good, but of course, if you're struggling, to get as much of these different plant-based foods into your diet then a lot of people are really struggling, I guess. So I think it's important to marry the social economic side to the scientific side. If we want this to become something that actually makes a difference.
No, you're entirely right, because eating a sort of like vegan diet with enough nuts in it is not cheap. I mean, if you're going to eat, I mean, people say, oh well, vegetables are cheap. Well, they are cheap if you're going to eat sort of, and I know it's good to eat seasonal produce that's locally sourced, but by the same token, that would mean in the winter I'd be eating potatoes and cabbages basically for 6 months. And I don't know that or my digestive system could take that. But if I were on a sort of a more limited income, then getting a sort of appropriate nutrition, and without that, working 3 jobs in a day, and the affordability of food, the idea of being able to have something that's that's healthy and varied is just a real challenge. And I think that is it's a huge problem, and it's a far more important problem than people realize.
I think that's very true, and just recognizing what you just said about the there's a time and skill implications as well. It's one thing getting a cabbage, it's another thing figuring out how you're gonna deal with this thing to make it tasty.
If you can with a cabbage, but I'm an aversion to cabbages. Sorry, you're at the end of the article, you suggest 3 preventative strategies, 3 ways to solve the mental health crisis, but
right.
but they I mean, they do seem to me to be wonderful strategies, and I wish that all governments in the world now listen to you explore them.
Listen up, governments.
So tell us them.
Right. So the three that I focus on here are intended, really, I think they're the ones that we get the biggest bang for our buck, to put it that way. They're not the only things that we could do, but I think they're the three things that would make a big difference and would clear up researchers, clinicians, and social workers and other people to tackle the other causes of mental health problems that can be really difficult to deal with. So the first one is universal basic income as a way to lift people out of poverty, to reduce inequality, to promote social interaction and community building. These were all the lack of those things. So having poverty, inequality, social isolation, and community disintegration were all the factors that social psychiatrists and psychiatric epidemiologists identified as being particularly harmful to mental health when these sort of topics were researched in earnest during the middle of the 20th century. So we've known this for a long time. We just haven't really done much. In fact, in many ways, like with austerity, we seem to be going in the opposite direction. So I think UBI, it might not be the perfect solution, but it's the best solution that I've seen to tackle these things, which are the core social determinants of mental illness. So that's number one. The next one relates to what we were saying about food. So really taking what science is starting to tell us now and what history would have told us a lot longer before that about the relationship between food and mental health, and basically work at making good, healthy food affordable and getting rid of all the bad stuff. And by bad stuff, I would start with chemicals. And a lot of this, again, is these are socioeconomic interventions. The reason we have preservatives in food is to lower their cost. These are, if we're able to structure our lives a bit more around food and healthy food, then this would make a big impact, not only our physical health, but our mental health. And remember that physical health and mental health are, as one social psychiatrist put it in 1962, hopelessly intertwined. And I mean, that's absolutely true. If you're dealing with mental health problems, your physical health is going to suffer. Many people dealing with physical health problems suffer from mental illness as well as a result. So that's number two. And then the final thing, again, relates to what you're saying about ecology, and that's access to nature. In various ways and physical activity in nature. This is something that I think we all know intuitively, but during the pandemic in particular, people talked about how, when they were forced to go outside, because we weren't able to go outside. When we were able to go outside, we really enjoyed it. And we had that beautiful spring and, the birds were singing and people just seemed to recognize all this beauty and wonder that was around them that most of the time we don't recognize because we're so busy with our lives. So if people were given more opportunity to engage with nature, and not just in, kind of utilizing nature, but actually engaging with nature. One of my favorite things to do is eco-volunteering. So I go up into the Scottish hills and I plant trees and I root out invasive species.
That's what I do too. I do the same. I do the same.
And it's probably when I feel the happiest in a way, because it's enjoyable, it's nice physical activity, and it makes it feel like I'm doing my part, a little thing to make the world a better place. So there's lessons in all these three things. And, if there was political will, we could do a lot on these three things. And I'm as convinced as I am about most things, that they would make a big difference in alleviating or in preventing mental illness, but also helping people already dealing with mental illness as well. In fact, on the last one, there's a really good podcast on the BBC. It is called, I think, Almanac for Anxiety. And the Helen Needham looks at five elements plus soil and how people engage with these things to deal with their mental health. It's brilliant. Each episode is only about 20 minutes, but I highly recommend it.
Oh, that's brilliant.
So soil, fire, water, air, and
wood. No,
wood. Yes, wood.
Wood.
Yeah.
That's what I was doing yesterday. I was coppicing, which presumably is something that you might be familiar with. So hazel, it was something that used to be done a great deal in this country. That hazel, you can cut it back when it's like one stem, and it grows into many, many stems. And it used to be I'm not sure if it's English or in British woodlands. The woodlands that we had remaining in the 1880s was 50% coppiced woodland and 50% high canopy. And our native species are particularly adapted for dealing with this coppice woodland, because in their traditional landscape, there would have been big herbivores going through, breaking open bits of the woodland. So you didn't have a majority of sort of dense woodland. You had this kind of mosaic. And by now, only 3% of our woodland is actually coppiced woodland. So it feels like something, sorry, this isn't meant to be a sort of conservation podcast, but so yesterday there was a very overgrown coppice, and I was, sawing down these stems, and some of them were just sort of like this thick, and there's me with a handsaw, and I was completely on my own for 4 or 5 hours cutting down bits of hazel and processing them to make stakes and binders and firewood and putting them into these different piles. And most of the time I'm listening to podcasts and audiobooks and things during this day, and I didn't have anything else. And I found myself talking to each bit of wood saying, well, what do you want to be, a stake, or do you want to be a binder? And and just and feeling just so part of this sort of place. And I've been volunteering with the Wildlife Trust for the past few years now, and every time that I'm out doing something sort of physical outside, there is this, I'm in flow, and it is just wonderful. So anyone who wants to volunteer in the United Kingdom, the Wildlife Trust, very good place to start. It is wonderful. And I think those three suggestions, they make such absolute sense. And all we need is political will. And that's as often the sticking point, isn't it?
Yeah, I think, we get glimpses of hope, I suppose. So here in Scotland, at the last Holyrood election, 4 of the 5 parties, no prizes for guessing which one was the outlier, had universal basic income in their manifesto.
Really?
So that was a really positive thing. There's a lot more talk about these things now than there has been for decades and decades, like the food or food nutrition, access to nature, and UBI. So I think, it's better in terms of awareness. It's just that from awareness to action, I guess that's the stage we're at. But, I think the more people hear about these things, the more they start thinking about them, then maybe we can start convincing, people in power to make, to be a bit more bold about these things. The Green Party, I'm sure would be for all these things. Well, they're for UBI, and I know they're for good nutrition in the environment as well. So I think that there is hope, but we just have to keep banging the drum and articulating the case as much as we can.
Well, Matt, this has been absolutely wonderful, fascinating, and inspiring. I don't know if there's anything else that you wanted to bring up. I'm aware that I've exceeded the agreed time by 6 minutes. So, but I don't know if there's anything else that you wanted to bring up, or ways that people could find you, read you, just to flag that up at the end.
Sure. So I'm at the University of Strathclyde, and I'm in the history department, and I'm very easy to find online. All I would say, I guess, in addition, is that if people are interested in exploring some of these ideas further, either as part of a course or just reading stuff, just get in touch with me. I'm happy to correspond.
Thank you ever so much. And thank you so much for being on Shrink Wrap Radio.
Thank you. It was a pleasure.